We're going to record again. Okay, so let's see. Participants here. I'm not sure why it is doing this, but here we go. View. Okay, speaker. Here we go. View gallery. There we go. Okay.
All right.
So, couple things, because we can definitely use this for some quick little blurbs, especially for social media where people want information really quickly. So why did we do this, and why did we choose this presentation? Working here together as pulmonary lifestyle medicine and orthopedic surgery with this phenomenal physical therapy team here. We're all colleagues, and so we see each other as being on the same team. So when we have a case or a situation that comes in, it's not uncommon for us to reach out to one another and each other and see, hey, how can you teach me, teach our patient? We had a patient come in recently who had tremendous kind of shortness of breath and chest pain. So she's established in the pulmonary clinic. We got her in thinking maybe she fell, maybe there was a rib fracture or whatnot, some chronic lung disease, maybe it was the lungs, only to find out that the plain films suggested maybe some changes to the spine, and then subsequently CT scan imaging to rule out a blood clot in the lungs revealed that she did have a T7 compression fracture. And what was interesting, it was a very, very typical distribution, as you saw on Dr. Espinoza's slides, that she did have trouble breathing. She had this wrap around, what we call that kind of, dermatomal panel there. But even knowing the patient, that wasn't the first thing on my differential diagnosis, right? And so then knowing that, have I had patients before that this has happened to, especially patients being on chronic steroids for maybe pulmonary reasons? Yes, we have. Is it recoverable? Yes, it is. And I wouldn't be able to sit here unless having seen that happen in another patient who did wear the brace, came to physical therapy, is now very independent and driving again, which is impressive. But a couple of things that I wanted to ask you about. You mentioned the fact that most of these compression fractions, and by default, osteoporosis happens predominantly in females. Is that what typically you see in your practice? Like, have you ever seen a male with this, or is it truly mostly females?
So the vertebral fractures are predominantly in females. In males, you'll probably see a higher risk of the hip fractures.
Okay.
So, and then wrist fractures can happen in either one.
Okay.
Either group.
Because that's interesting. You say that as we're getting DEXA scans, especially females, perimenopausal, postmenopausal, the one thing that we keep talking about is the influence of the hormones. And so we know that there's a significant down presence, if you will, of estrogens in that peri-postmenopausal phase. That's a whole, another issue that obviously our OB-GYNs are tackling in clinic. But I do think that there's an inherent responsibility that we all have with our patients, with our community, to talk about things, as you mentioned, movement and strengthening and getting that infrastructure, if you will, the musculature, the gait, the balance, the thoracic capacity up and running, so that the first order of business, would you agree, is to prevent the fall in the first place by having a healthy muscular system?
Oh, absolutely. If you can work on your balance, your strength, your proprioception, avoid falls, that'll limit the wrist fractures and the hip fractures. The compression fractures can also occur with falls, but the motion and the strength will actually probably protect you more from just that slow chronic collapse.
Perfect. And you also mentioned the GLP-1 agonist, which I think is very, that's hot off the press. You said recent article.
Just came out 2 weeks ago.
Impressive. So now you can see how working together as lifestyle medicine pulmonary, right, is beneficial, because I learn from him all the time. And what I've asked him before, what I've even asked our physical therapy colleagues is, they are so beyond, a wealth of knowledge, but you have to kind of tap on the door and ask. So what I've learned and what I continue to learn is it's all about that initial assessment and getting them to kind of see where we need help with balance, where we need help with strengthening. I myself have come to them and, they're able to say, hey, listen, if you're going to do impact training, these are the things you should work on. Maybe, this leg may be a little longer than the other one, whatnot, but it's a phenomenal experience if you can set aside that time to do that. But specifically the GLP-1 agonist, yes, we have a rapid amount of weight sometimes in patients. So everything, their balance, their center of gravity is kind of thrown off. But what I've seen is, I don't want to say muscle wasting, but to some degree, they don't have the muscle tone that they used to have. And these are unfortunately in peri or postmenopausal women when they're basically just adding insult to injury with the decline in estrogen.
Correct.
Right. So
it's a bad perfect storm.
Perfect storm. And so and then obviously you and I have spoken about this. Getting information, data, it's not a treatment, it's information, it's data, but then it can definitely fuel options for treatment. In which case I would say, speak to who you know and love, your primary care physician, your OBGYN, read about all the possible pharmaceutical interventions that can be undertaken for the treatment of osteoporosis, but it doesn't really get better than movement and nutrition as your first and second go-to. Movement, balance, gait, strengthening, and then nutrition. What are you putting in your body? Do we need supplements? If so, what kind of supplements? Should it be pill supplements? Can it be gummy supplements so that we don't obviously irritate the esophagus? And one of the things you and I have talked about a lot over the years is I've come back and said, oh my goodness, I wonder what these high dose steroids are doing in this patient population. And throughout my career, I've tried to obviously look for avenues where we can decrease the need for chronic steroid use, whether it be in COPD, asthma, pulmonary fibrosis, autoimmune pulmonary diseases. But I mean, is that something routinely that you all are educated on in training as far as decreasing systemic steroids and the impact?
No, that's where the fragmentation of medicine comes into play with 42 different medical specialties. There's just not enough time in the day to elicit that kind of history. You can touch on it. If you have an interest, you can definitely ask, and it does contribute to the holistic picture of that individual in front of you, your patient. But for the most part, unfortunately, it's not being stressed. So it's an undertaking that an individual needs to educate themselves on. Families need to be educated on as well, and providers. So this is something that I've relatively recently come to appreciate and focus some energy on to help the patients that we serve. And that comes from working together, and that's that pulmonary, orthopedic, lifestyle medicine, spheres coming together with the physical therapy, with all the young athletes that we have, with the older octogenarians that we see. It's all part of this path that we're traveling together.
Absolutely. We're just all walking each other home, and anything that we can do to continue to optimize just that, the movement and the walking and the knowledge. And I think I've appreciated the healing maneuvers of just, having a patient quite literally come and see what it's about in the physical therapy floor. And then they learn so much. And then it's re-edification of the things that we all are saying as medical specialties. And again, can't reinforce enough the importance of speaking to physical therapy, having your evaluation by physical therapy, following through with your physical therapy. Don't just start and say, okay, I'll do it at home. If they want to see you, they want to get you on the gym floor, it's for a reason. And again, once you see this compression fracture diagnosis, it's very difficult to unsee it. So reach out to us. Let us know if there's any other questions you have. We'll make this video available for anyone and everyone. Pass it along. Don't forget, we're made up of our genetics and our DNA. So if you have a loved one, family, older aunt who has had a compression fracture, you probably carry some of that DNA potential, but it doesn't mean it's 100% certainty. But as Dr. Espinoza said, you definitely want to make it a little bit selfish and say, maybe I should be getting my DEXA scan. Maybe I should check my vitamin D levels. So the epigenetic movement, I think, is upon us, thank goodness, but it takes all of us, and it takes a lot of good work, fun work.
That's right.
Absolutely. Thank you.
right.
Y'all have a good evening. Stay
Yes.
strong. Good night.
Stay active.
Stay active.